Hello everyone, welcome to our channel. My name is Zetu. Today I would like us to talk about the operation myomectomy. Myomectomy is the surgical removal of the fibroids from the uterus. Fibroids are known as myomas. Fibroids are non-cancerous growth or tumors that develop in the uterus. They can develop in the cavity of the uterus, or they can develop in the muscles of the uterus. Fibroids are more common to develop to those women that are still at the childbearing age. Myomectomy is a preferred method of treating fibroid if the woman still wants to have children. What are the indications of myomectomy? One is the pelvic pain and pressure as the fibroid is growing in the uterus. The second indication is the heavy and irregular menstrual bleeding. The third indication will be frequent urination. This is due to the pressure that is applied by the uterus into the bladder. And another indication is anemia that is caused by excessive bleeding. In most cases, medication can be given, but if the patient is not responding to medication, therefore myomectomy will be recommended as surgery of choice. There are different methods of doing myomectomy depending on the size of the uterus and where are the fibroids had developed. The first method, it can be abdominal myomectomy. Abdominal myomectomy is a major surgery where the patient will be open in the abdomen. Either it can be a transverse incision or it can be midline incision, depending on the size of the fibroid. Since this operation is major, the patient will need to be admitted to the hospital after the patient has been explained about the whole procedure, and the patient needs to follow all the precautions that needs to be followed when the patient is going to be coming to theater. Once the patient is in the ward, prior to surgery, all the necessary investigation will be done. What is important, especially with open myomectomy, the blood must be prepared, because another complications for this operation is bleeding. Therefore, when the patient goes to theater, the blood must be on standby or the blood must be available. And all that the doctor will prepare prior to surgery. When the patient is in theater, they will do abdominal surgery. It can be a midline incision or it can be transverse incision, depending on surgeon's preference. Once they are in the pelvic cavity, they will go into the uterus, depending where is the fibroid, and then the uterus will be open if it needs to, and the fibroid will be taken out, and then they will suture the area where the fibroid has been. In this type of operation, especially abdominal operation, if the fibroid is huge, there is a tendency that those patients tend to bleed. That's the reason that the blood needs to be prepared. You'll find that sometimes intraoperatively, if the patient is bleeding, the blood can be given during surgery. But all depends on the size of the fibroid. Blood transfusion can be given. Because of this major operation, the patient post-surgery needs to be kept in the ward for quite some days so that the patient will follow all the steps that is supposed to be followed by the patient that has gone for major surgery. And the patient will be discharged home with the instructions what to do, and medication will be given just to control the pain at home. And this patient will also be advised not to try to fall pregnant early because the uterus has got a scar. Therefore, they can be given or they can be advised to take some time for the uterus to heal, because if the patient can fall pregnant early, there is a possibility that that scar can open up, especially during the labor time while the uterus is having contraction. Therefore, the most important thing, the patient will work hand in hand, and the doctor will actually suggest the time when the patient can start trying to fall pregnant. Another method of myomectomy is laparoscopic myomectomy. On laparoscopic myomectomy, the patient will be prepared just like any patient that will be coming to theater. But on this type of myomectomy, surgeon will make small incision into the abdomen, and he will use the laparoscopic instruments. He will go in and remove the fibroid. Where the fibroid that has been removed, there will be some suturing as well. But all that is done under laparoscopic method. The other type of myomectomy is hysteroscopic myomectomy. On hysteroscopic myomectomy, it's usually done for those fibroids that are within the cavity of the uterus, and those fibroids that are protruding through the cervix to the vagina. Therefore, the procedure, the doctor will do a hysteroscope, will go in with the hysteroscope from vagina, cervix into the uterus, inside the uterus. And then you will connect the resectoscope and the fibroid will be removed. Once this operation is finished, depending on the patient's condition, that patient can be discharged home, depending whether the patient is comfortable. That patient can be discharged home with the pain medication and with the advice that there will be some bleeding, and if anything abnormal, he must also come or phone the doctor and report any complications that he may be facing at home. What are the complications that can follow post myomectomy? Complications are there for any surgery. But what is important, especially if the patient had abdominal myomectomy, that patient will be advised to have cesarean section. And the other complications, it can be surgical complication like infection, or it can be anesthesia complication that can happen to any patient who had surgery. What are the after effects post myomectomy? In most cases, it is reported that those patients that were suffering from those symptoms of heavy bleeding, pelvic pain is usually relieved post surgery. And the heavy periods that were usually a problem in most of the patients, they report to be improving thereafter the operation. And some of the effects, if the patient has been having problem of falling pregnant because of the fibroid, maybe that was inside the uterus, in the cavity of uterus, fertility improve because there is nothing that is in the cavity of the uterus, and it becomes easy for that particular patient to fall pregnant. For today, we will end up here. If you do like these short videos, please subscribe, comment, and share. Thank you for watching. Till next time. Be healthy and be